Hi, friends, and welcome to the Dr. Green Mom Unfiltered podcast. This is your host, Dr. Ashley Mayer. I feel so honored to have this opportunity to support you and your family on your parenthood journey. Just a note before we begin, if you enjoy this podcast and would like to support my work, please consider subscribing at drgreenmomvip.com. Subscribers have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. As always, I appreciate your support, and now let's begin. Hello, and welcome to the Dr. Green Mom podcast. I don't know what episode this is because I don't keep track of any of this. However, I have such a special guest here today for all of you because I found her on social media. She reminds me so much of me from like a few years ago. And I was so fueled by watching some of her videos that I had to invite her on here. I've never had a guest on Dr. Green Mom Unfiltered podcast before, except for my employees. And so I have to tell you, Miss Katie, that I am so happy to have you here today. She is on social media. Is it Katie, the physician's assistant?
KDC.PAC is my handle, but yeah, Katie the PA is how I...
Oh my gosh. She has been flooding y'all with such amazing informed consent over the past several months, and I have absolutely taken notice, and I couldn't wait to have her on. And today, this is such an important topic. We don't have enough informed consent around it, and this is such an important topic that I wanted to bring up and discuss with her today because she's on board with me. This is about Group B Strep in pregnancy. So you mamas, when you are pregnant, whether you know it or not, your obstetrician gynecologist is checking you for Group B Strep. And they ultimately are hooking you up to IV antibiotics at birth. And we want to talk about this because there's not enough information out there. And Katie and I were talking, and I actually didn't know this right before we started recording, that she has two babies. And I have two babies, and we both have had, way different births. And like I've always mentioned many times, is that the way I treat is based off of the person because we're all so different and we all have such different births. All of our birth stories are so different. So we just got to talking, and I didn't know this, but she has an amazing Group B Strep story and why she is so passionate about this topic. So can you just start, Katie, by telling us a little bit about yourself? I want to know more about you. Like, tell me, what is the world of Katie as a physician's assistant?
Yes, of course. Well, first of all, I am just extremely honored to be here. When her team reached out to me, I gasped. I was really starstruck. I use so much of Dr. Green Mom content in my own content. So it really is so exciting to be here talking with you. And I honestly think this podcast is so helpful for so many moms. So thank you. Thank you again for having me here. I am a physician assistant. I have worked in urgent care, family medicine, and now I do more of kind of wellness, longevity medicine. I have two babies, like you said. My daughter is 2, my son is 1. And yeah, basically just juggling, creating this educational content, informed consent, being a mom, working still. And, it's a lot going on, but it's so exciting and super fun.
This healthcare professional is doing a million things. Like all of us moms, we're spinning so many plates. And then she has time to create these amazing videos. And so she created one on Group B Strep. And I was quite floored about it because it's not talked about enough. And so I'd like to dive right into it. Let's chat. What is Group B Strep and what is Group B Strep?
Yeah, it's a bacteria that is naturally occurring on at least 30% of women in the digestive tract, urinary tract, and the genitals. And it is just a colonization. It's not necessarily like an infection. You can have some women will get UTIs with group B strep in pregnancy. That can happen,
Mhm.
but usually it's just colonized. It's just there and normal. It's just a part of the microbiome.
It's part of our normal flora. So
Yeah.
it's transient. That's what we say
Yes.
in medicine. It comes and goes. So
Mm-hmm.
Group B strep, depending on when you swab for it, which is what they do in pregnancy or a urinalysis, it may be positive and it may be negative. It just depends. So, if you swabbed this week and it was positive, you might swab again in 4 or 5 weeks and it's negative. So it comes and goes. So what Katie and I want to reiterate to all of you is that Group B strep is normal. It's a normal part of our flora and it just comes and goes. And so that is the foundation for what we're going to talk about today, because Katie and I were talking, up to 35 or 40% of women are receiving antibiotics at birth
Massive.
because at some point in time during their pregnancy, they're testing positive for Group B strep. So I want to reiterate very early on in this podcast that it's normal, mamas. It's normal for us to have Group B strep. It's not something bad. It's not like, oh my gosh, I just tested from some awful bacteria that's
Yeah.
invasive or is problematic. It's not an STD. It's a very normal part of our flora. It just so happens to have this like amazing polysaccharide covering that likes to take hold of maybe potentially newborn infants. And so we're
Yeah.
going to get to that. So let's talk about that. Let's talk about what are the problems for a newborn. So mama goes through, it has to be a vaginal delivery, guys, not a C-section. So mama goes through a vaginal delivery, and there are two types of disease that may happen to the newborn because you happen to be Group B strep positive while you are delivering. Katie, do you want to talk about those two types?
Yes. So you have early onset disease, which is within hours of birth to about 7 days. And then you have late onset disease, which is after 7 days up till about 3 months. And the early onset and the late onset have similar symptoms. The most serious complications are sepsis, which is a blood infection, pneumonia, and meningitis. So, three really serious complications with that, and the symptoms that go along with that.
Absolutely. And so we are here to talk about the early onset and what IV antibiotics do for early onset, because IV antibiotics are not helpful for late onset GBS disease for a newborn, but they are potentially helpful for early onset. And so that's what we are going to discuss. And so keep in mind that your infant, when they are born, if mama is Group B strep positive at birth when baby's born, there's a 1 to 2% chance that babe may get this Group B strep disease. Okay? So that's if you do not do antibiotics at birth. All women who are Group B strep positive at birth have a 1 to 2% chance of their babe also having Group B strep disease. Now, keep in mind, we think 1 to 2% is really low, right? But if
Not that low.
if your babe is that 1 or 2 of 100,
Mm-hmm.
then it's actually not that low. So that's why
Yep.
we want to chat about this. Okay. So we've talked about the early onset and late onset for babe. And yeah, you're correct. So it's sepsis and pneumonia. Meningitis is typically more often for late onset, and it's super rare, but it does happen. So we want to inform parents to make sure, we keep this in mind. And then Katie, what is the colonization? What's that for in women? What's the percent of women?
It can be 20 to 30% of women are just naturally colonized most of the time. Like it's a transient bacteria, but you're
Mhm.
basically just naturally
Yeah,
colonized.
so it's up to 30% of women. So this is so normal, guys. It's so normal. And I want to get into the meat of this, and I want Katie to share her story because I have a problem. I have a real problem with the testing.
Yeah.
So the screening. So it's there's different ways to screen for Group B strep in pregnancy. And I'll just come out and say it. I've had hundreds of women who have reached out to me who are like, I can't believe this. I'm 7 weeks pregnant and my OB tested me for Group B strep in my urine and I'm positive. And so now they're telling me that no matter what, even if it's negative in the next 30 weeks before I deliver, I have to have antibiotics at birth. Like, what the heck? Doctor, can you please help me, Dr. Mayer? I don't understand this. And so, Katie, I think this is a perfect time for you to share your story about how this went for you, because this is the problem that most women are having right now is they don't understand and their doctors are not explaining to them
What it means. Yeah.
yeah, if this is transient, why the heck can I test later? And if it's negative, why do I still need antibiotics?
Totally.
So what are your thoughts, Katie? Tell me about what happened with you.
So I have two babies and two different stories with this. So I'll try to be concise here. But basically, with my daughter, my first child, at 36 weeks, I was expecting a swab because I'm a PA. I knew I needed a swab. Not all women know going into their appointment that they're going to
No.
get it's a vaginal anal swab.
It's like ooh, did you just do that? Like, what are you doing to me down
Yeah,
there?
totally. So I was expecting like, okay, I'm 36 weeks here for my appointment, had a typical OB. I didn't have a midwife at this time. And so I show up and she's like, oh, well, at the end of my appointment, I asked her, I was like, I'm not going to get swabbed today. And she was like, oh, you're not getting a swab because you're getting antibiotics in labor. You tested positive in your urine.
Like, how long ago?
Like when I was my first appointment, when I was 7 weeks, when they test your urine and they do the culture, that I was positive. And she never told me. She never told me I was positive for Group B strep in my urine at 7, 8 weeks or whenever my first appointment was. And so I am hit with this wave of like, oh my gosh, like, because I totally, I never had any issues throughout my whole pregnancy.
She didn't give you 30 weeks to prepare.
No, I'm like, I need 30 weeks to prepare for this. Like, this is ridiculous. So, total lack of, just informed about my own body. It's not even consent there. And she didn't even give me informed consent. She was just like, you're just going to get antibiotics in labor. That's how it is. Yep. And I'm like, excuse me? Like, do we get to talk about this? And, she was really surprised when I brought up the conversation, like, do we get to talk about this? Like, is this an option? And so I didn't tell you this, Dr. Mayer, in our earlier conversation, but I asked to retest again. Good. And she was like, well, you went positive in your urine. We don't do that. It's not recommended. And I'm like, well, please test me again. And I looked up all of the fun midwife tricks. Actually, your resource on Group B strep was helpful for me. I tried all the fun tricks. And that's probiotics, getting rid of, sugar in my diet because bacteria really feeds on sugar, and, taking like some garlic, yogurt, trying all the fun things. But one midwife trick I think really worked was a little Hiba cleanse right before I did the test. So I basically sterilized myself prior to the test.
I'm not saying you guys do this, but
yeah,
she
we're
did
not saying
do
you do
this.
this. We're not saying we do this, but that's funny. So I basically did that and I was negative. And so I tested negative. And so she's like, okay, well, I guess you don't need it now, which is so funny, right?
Typically, if you, and I'll give you this tidbit of info, guys, gals, women, pregnant mamas. If you are positive early in pregnancy through your urine, whether you get antibiotics or not, because depending on the bacterial count in your urine is dependent on whether you need antibiotics like early in pregnancy for Group B strep. But if you don't have them or whether you do have them, the OB is still going to want you to have antibiotics at birth. So keep that in mind. But what you can do, guys, and this was for later in the podcast, but I thought it's a good place to bring it up now, is that if you're positive with your urinalysis early in pregnancy, you can ask for another urinalysis late in pregnancy in 37 weeks, and then also follow it up with an anal vaginal swab. So I typically like to say both. So get the urinalysis. And I'll tell you the reason why doctors will say, hey, you were positive in your urine early on, and so you need antibiotics right now, is because the American College of Obstetrics and Gynecology have a position paper, and they say that if it comes positive in your urine, then that means you are so highly colonized with Group B strep that, just looking based off of the research and all of past experience that they've seen over the years, is that you are so much more highly likely to be Group B strep positive during delivery. And so that's why they recommend that you have antibiotics at birth. It's because if it's in your urine, you are so highly colonized, guys, that it's important that they say you need antibiotics at birth. So what I say is, well, that's kind of silly, because what if I did a urine test at 37 weeks and it's negative?
Yeah.
So obviously I'm not highly colonized right now. And so also follow it up with a vaginal anal swab.
Yeah.
And that is what I tell patients who want to be informed on what they can do. Now, OBs may say, hey, I'm not doing that. And that's a problem, because you may have to find another one. Or you go to LabCorp or SonoraQuest and order it for yourself. I didn't tell
Yeah.
you that, but I'm kind of helping you out a little bit. But was
Yeah.
that was for one of your kiddos, right?
That was for my first. So I knew that I did this trick here. And so I, in the back of my mind, still was aware, okay, I might be colonized with, Group B strep. So I really wanted to think about the risk factors. I think it's good that we bring up right now kind of the different screening methods we use,
I love it. Yes.
because that kind of goes into how I made my decision for my labors. So in the US, we use the universal screening method, which means every pregnant woman at 36, 37 weeks will get the swab, and then you get your recommendation. Because you are positive, you are recommended to get antibiotics in labor. That's the way we do it in the US.
Yes.
In Europe, they go off a risk factor approach. So they do the same urinalysis early on in pregnancy. And if you're positive in your urinalysis, they will still say that you should get antibiotics in labor for the reason that Dr. Mayer just explained. But if you're negative in your urine, they will later give you those recommendations based on if your baby is premature, if you have a prolonged rupture of membranes, or if you have a fever during labor, or just a prolonged labor in general. And I think there might be a couple of more. Those are kind of the main ones, though, I think, correct?
If there was a GBS positive in a prior pregnancy.
Yes. Mm-hmm.
Or if you had a prior pregnancy with a kiddo with GBS disease. So
Yes.
typically those are the ones. If the gestation, and I'm just reading them, if the gestation is less than 37 weeks and it's preterm labor, which you mentioned, or an unknown GBS status at labor. So that wasn't you, because you had already known what your GBS status was. And so that's why I like Europe standards. So I like that Katie mentioned this risk-based way of treating for Group B strep, because here in the United States, it's like tough shit. You tested positive at 7 weeks in your urine. Pardon my language. If you're in the car and you've got your kids in the back and you're listening to my podcast, I apologize. But my son always lets me know about that word. But that's the reality here in the United States. And then OBs don't want to touch you.
Yeah, they don't.
They're like, hey, if you're not getting antibiotics at birth, it's a CYA. It's a cover my ass. Sorry.
Yeah.
It's another one. I don't want to be a part of this. And so we're in this like really tough position where I'm trying to offer informed consent. Katie's trying to offer informed consent. But the reality is, hey, this is common sense. Like, allow the pregnant mama later in pregnancy to do what Europe does, test the urine again later in pregnancy, and then also follow up with a swab. And then we'll make an informed decision, because Katie didn't have any of those other risk factors when she was in labor. And so what she decided, which was best for her family, was to go ahead and say no to the antibiotics during birth.
Yeah.
Now, I had a little bit of a different situation with my firstborn. I was not Group B strep positive. And I was telling Katie I actually didn't know whether I was or not, because when I was a very young doctor. I was only a year out of I started practicing for a year, and I wasn't doing I wasn't doing not family medicine, but I wasn't working with pregnant women at the time. And so I was very unfamiliar with all of the testing that was involved with pregnancy. And when I was delivering my firstborn, my water had broke, and then I was in labor with her for over 24 hours. So I'll tell you this, if I was Group B strep positive and I had said no to antibiotics initially, I probably would have said yes to start the antibiotics with her because my membranes had been ruptured for so long with her still having not been delivered. And
Yeah.
so I want to stress this, guys, that no matter what Katie or I say that we would do personally, we're not you. We have
Yeah.
very different lifestyle factors, and all of us are different. And so for me to say across the board, like ACOG does, the American College of Obstetrics and Gynecology, across the board, all women should get antibiotics. I don't believe that to be true because we have these other risk factors that Katie and I had just discussed. And so keep that in mind,
Yeah.
that what the recommendation for you may not be the recommendation for me. Because again, I probably would have opted for antibiotics.
Yeah. If I was in your situation, I definitely would have also, because this was a totally tough decision for me. Like, it really, knowing the risks of Group B strep disease, it can be totally serious. But we also, will go into this in a minute, we know antibiotics in labor aren't without consequence, like that's definitely something to be aware of. There's risk with that. There's risk with any intervention in pregnancy and labor. So we want to give that informed consent to you and just know that both decisions come with some risk. And we really want you to weigh your individual risk with your individual benefits. So, in my situation,
Mm-hmm.
my mom had really short labors. And I just, in the back of my mind, was like, okay, well, if this goes the way that my mom had previously, this will be great. And then I won't have to do antibiotics.
And then it did.
It did. It was great. I had a 5-hour labor and my water broke as I was pushing them out, and that was both of my babies. So, and I tested positive for Group B strep for both of my kids. I didn't retest negative for my son, actually. I was still positive, and I declined the antibiotics at the time just because of the way my labor was progressing.
Yeah, and that's the thing is, the more informed we are, and I hope that you're all listening to this podcast, that you're becoming more informed, is that there is a choice during labor. So if you have declined antibiotics at birth or said yes to antibiotics at birth, you can change your mind. You can less change your mind when you're doing a hospital birth. And so keep that in mind with whoever your OB is or whoever your midwife is. But you can make a change. So if you've declined them and then your birth is not progressing or your labor is not progressing, you do have a choice to say, you know what? I did say no to antibiotics, but I think now might be a good time to start them. And so it really is important to be fully informed of all of the reasons why Group B strep might be problematic, and not just because you tested positive. I am placing in the show notes. So all our show notes that will be available in your VIP membership, they will have all of this information for you. So I don't want you to feel like, oh my gosh, I have to rewind this podcast and I have to go
Yeah.
back and what was it? Like my labor's not progressing and membranes and what? So
Yeah. Yeah.
all of this information will be in your show notes. So let's talk about antibiotics. First line, what is first line therapy? What is first line antibiotic for labor?
Yeah, it's typically penicillin, right? It's something where it's IV penicillin, and they recommend one dose every 4 hours. Or is it every one? Is it one dose every hour for 4 hours?
I have no idea.
Because I've gotten different information about this, honestly.
All I know is it's antibiotics during labor.
So what's interesting, this is funny. So we can check up on this for you guys, but I've heard from different nurses, I think protocols change within hospitals, honestly, because some will say it's one dose every hour for 4 hours at least, because if you don't get that 4-hour exposure to antibiotics, it's not as effective at protecting against Group B strep disease. There was I've read a couple of resources on that. However, what's interesting is some hospitals will say, okay, if you get at least 2 doses in, then you will be adequately covered. But in terms of the timing, if you're thinking about, okay, is my labor progressing fast enough to, decline the antibiotics or not, they would say you need at least 4 hours of a chunk of time to get adequate antibiotic coverage.
Yeah, because some women deliver so much faster than 4 hours. And so are they stressed about whether did I protect my child or not? And that's something that you can discuss with your doctor.
Mm-hmm.
I am not an OB. And so
Yeah.
I know that there are antibiotics during delivery. I know that penicillin is the choice. I do know that if you are allergic to penicillin, then it's typically clindamycin or cefazolin. And then I think the last option might be vancomycin. So those are the options during labor with those antibiotics. And so let's talk about like what are the pros? So say mama decides or has to get antibiotics during labor. Let's talk about the pros, and I'll start off is that I have the research right here. The information is that prophylaxis with antibiotics for Group B strep during labor reduces early onset GBS disease in the newborns by up to 80%. Now, having said that, I'm going to put it into context. It goes from 1 to 2%, which is what Katie and I had mentioned earlier, down to 0.3%. So it's quite a large decrease in Group B strep disease by doing this antibiotics at birth.
And we've seen a decline in the incidence of Group B strep disease with the initiation of antibiotics in labor. And that's both in America and in European countries as well.
Yeah, so I think that's like the main pro. So what all mamas want to know is like, hey, look, if I have to give antibiotics, am I really going to decrease the likelihood of my kid getting this GBS disease? Yes, by 80%.
Totally.
I want you to keep that in mind. So, what are the cons, or let's talk about what the risks of antibiotics in labor and delivery are for
Yeah.
mama and babe.
Yeah, this is where the conversation I think gets a little more interesting because
Mhm.
with any intervention in labor, you have the risk of more interventions in labor. So we consider that the cascade of interventions, right? I've actually seen women choose to be induced for the reason of getting antibiotics in labor. So they chose an elective induction in order to be able to get this antibiotics because they were concerned about this issue. So with, if you're choosing to be electively induced, that comes with its whole set of risk also, right? You then may need Pitocin or, you're using all of the interventions in order to get your labor going at a time, prior to when your labor might have actually started. So there's inherent risk which with each of those interventions.
Yeah, I had to have an epidural, and
Yeah.
because my labor would just simply not progress, I sat at like 3 centimeters dilated, and the epidural went north. It did not go south. And so keep in mind, guys, that with every intervention ends up being probably more interventions. And so this isn't just with Group B strep, but this is with just labor and delivery in general. Not to scare you, but with antibiotics can end up, becoming more interventions. And one of them is mama doesn't know it, but she has an allergen. She has an allergic reaction to the antibiotic.
Yeah.
So that's one problem. Another one is there's unnecessary exposure. So now you have like all of these antibiotics, and now mama has a weakened immune system because she has a weakened microbiome. She's also sending this over to babe. So now babe is being born. They're quite sterile to begin with, but they have now issues with their microbiome because mama had antibiotics, during labor. So
And some risks with, the antibiotics in labor for mom also would be like a yeast infection is very common after getting antibiotics. And what can be even harder is if that yeast infection can actually spread to the skin on your breast and on your nipples and in baby's mouth. And that could lead to poor feeding also. If that yeast infection is that bad, that, it'd be painful for your baby to eat. So that's something to consider when you're getting antibiotics in labor, to, maybe take a probiotic afterward to make sure that you're not going to be, having a crazy yeast infection afterwards.
Yeah. So since you've mentioned that with probiotics, let's chat about a lot of mamas don't have an option. They don't have a choice. They have to have antibiotics in labor or they're not going to be able to deliver there. And so, what are some things that mom and babe can do after delivery so that they can help to support their microbiome after delivery?
Yeah, that's a great question. Also, probiotics, like I mentioned, is going to be really helpful in protecting yourself and your baby against yeast infections. But that also is just balancing and kind of bringing back that good bacteria. You can also take prebiotics as well to help feed the good bacteria in your gut. And then also just having really nourishing foods after when you're postpartum, and including fermented foods also that have a high probiotic count. So lots of warm broths, roasts, soups, and then add like a little sauerkraut in there to help with that bacteria. I mean, really, it's not a lot of women like sauerkraut, but I like sauerkraut.
I like sauerkraut too. But yeah, fermented foods are beautiful if this is
Yeah.
something that has to happen.
And you, Dr. Green Mom, you offer your baby, you have a probiotic formula, correct?
Yes. So I have a probiotic for infants, but I also have one for mamas. And so what I highly recommend for infants after delivery, if mama had to do antibiotics during labor and delivery, I do have a probiotic and it starts at age 6 months. In my medical practice, I dose it one half of that dose for the first 6 months of life. So this is not medical advice, but it's what I do in my medical practice. It is a broad spectrum probiotic. So it covers several strains, not just one or two, which is what you typically find in your infant, like liquid probiotic. You'll find one strain, maybe two, but this one is a broad spectrum for infants. And so for your newborn, I dose it one half of the scoop for the first 6 months of life. And mamas, we have two. We have an antibiotic support probiotic, which is Saccharomyces boulardii. And I typically recommend mamas take it for 2 to 4 weeks after delivery. And then a women's health probiotic, which I formulated most importantly for hopeful prevention of Group B strep. So we're going to
Yeah.
talk about that here in a second. But what's most important that Kitty and I have both mentioned is probiotics after birth. So if you must be on antibiotics during delivery, whether it's for Group B strep or for something else, guys, a probiotic for both baby and mama is super highly beneficial to help repopulate that microbiome. Okay. And since we were talking about natural approaches, so Katie did mention fermented foods, which are super high in probiotics, and like full fat, like really amazing yogurt is also. But if you're going to do Chobani or Yoplait, like those have like zero cultures in them of probiotics.
Unfortunately. Well, Chobani actually does have a full plain Greek style yogurt that actually
They
does have
do?
some. Yes, they do. Yeah, I buy it at the store.
I didn't know.
Yeah, I don't think Yoplait does.
I've not been a fan of Chobani. I think it's because they do 0%.
Yeah, the one I get is a full fat. It's like, it's the red label. It's a full fat, yeah, Greek style yogurt. Yeah, I love it. It tastes great.
There's a Painterland Sisters, I think. Have you seen that in the store?
No, I haven't. No.
It's hard to find. I found it at Sprouts, but anyways, it's called Skyr. It's not actually called yogurt.
Like kefir almost?
It's a thicker probiotic. They say it's cheese, but it's not. It tastes just like a regular yogurt. It's so good, guys. Sorry, I'm getting off track.
Well, kefir's really good too. Yeah, this is a really fun tangent though, because I put kefir in my smoothies and I love.
Those are great probiotic strains too. So you don't have to specifically have, an actual probiotic capsule or probiotic powder. So these are just ways that you can get like healthy strains into your gut. But let's chat. There's a lot of controversy with how to prevent Group B strep because it is part of our natural flora. So what we're
Yeah.
really trying to do is go against Mother Nature or whatever you believe in, and we're trying to reduce the amount of colonization for Group B strep. And so let's uh let's chat about when I say that. Every time I say the word chat, Katie, I think about you now. Cuz you're like, "Let's chat about it." So whenever Katie does a video on social media, she's like, "I'm Katie PAC. Let's chat about it."
Let's chat.
So anyways, let's chat about it.
The fact that you think of me with that word, I'm like honored. That is really
Like,
fun.
let's chat about it. I
Let's
do.
chat.
I want to chat with Katie about this. So
I love chatting about this. No, this is great because I literally tried all of them I tried them all for my daughter plus one, and then I didn't do one of them for my son, and I tested negative, and then I tested positive. So some things you can try. We talked about probiotics. That's huge. Decreasing sugar in your diet, or even just yeasty foods like bread. Even if you're making your own bread and you're adding yeast to it, that is going to be contributing to feeding that bacteria in your gut. So getting rid of kind of yeasty, sugary foods, that's going to be important. Garlic is an interesting one. People will eat garlic, but also some really adventurous folks will try to throw a clove inside their vagina. And I did not try that because I am a little weirded out by that one. But I know people who have tried it.
let's chat about that, Katie.
Let's chat.
So if you're going to do garlic, if it's going to be oral garlic, it must be allicin. So allicin is the component in garlic that is going to be beneficial for Group B strep. So you want to find a product called allicin, or you want to
Oh,
do whole garlic. So if you do a whole
yeah.
garlic clove and chew it up, great. Now, I do not recommend putting cloves of garlic in your vagina, but a lot of midwives recommend it. Now, here's the thing: garlic will burn the mucosal lining of your vagina, and it will cause a lot of pain and may cause wounds in the vagina. So, I don't necessarily recommend doing that.
This was on Google when I was looking up that. So this is what this spit out, but also botulism with raw
Yes.
garlic.
So
Like,
let's just be careful with putting raw garlic in our vagina.
yeah, let's not do that one.
I'll tell you the natural approach that has the most research to it that I can stand behind is probiotics. So there are certain strains of probiotics like Lactobacillus plantarum, rhamnosus, reuteri, and salivarius. Those strains have some really great research behind it to keep Group B strep at bay. Now, the product that I formulated, the Women's Health Probiotic, has all of those strains except for salivarius for other reasons. And so the research recommends 1 to 2 billion CFUs of each of those daily. And so I highly recommend throughout your pregnancy, and I'm not plugging my product. Actually, I am plugging my product, but you can take any product with those strains, okay? And it's in the show notes. So if you can find a really good probiotic that's not mine, which is Dr. Green Mom or Dr. Green Life Organics.
I would obviously recommend yours, but there are other brands out there if you need to find one.
Yeah, so keep in mind if it's any of those strains, there has been some great research, and I have the research that we'll post in the show notes for you to be able to take to your midwife or take to your doctor to let them know, hey, look, I'm doing these things right now, and I want tested. I want retested for urine. I want retested for anal vaginal at 37 weeks. I think that's the whole point of this podcast is like,
Yeah.
you guys need to stand up for yourselves and you need to say, this is how it's going to be and this is how it's going to go. And if I'm negative for both of these, I want to be like the Europeans. And I am going to say no to antibiotics at birth if I'm negative for both of those. But let's talk about zinc. So, zinc up to, I think, 40 milligrams in pregnancy is safe. And that has shown beneficial for Group B strep and colonization.
Isn't that interesting?
I know. I love all these natural things. They say that zinc is the metal of life, and I absolutely believe it because I think that zinc is included in almost every protocol that I've ever given to a patient.
Yeah. That and magnesium for me
Mhm.
too. I mean, yeah, but zinc and Group B Strep. It's interesting how mechanistically we probably wouldn't really know how that worked, but that helps.
Yeah, and I'm also linking in the show notes articles on Dr. Green Mom on how to make your own probiotic suppository at home. So I have a recipe, and thanks to Letizia, she's one of our medical writers. I think she actually used this in pregnancy, and it was super beneficial. But there are probiotics that you can insert vaginally as well. And so we have they're kind of hard to find over the counter. So that's why we
Yeah.
linked a recipe on how to make them at home, and super, super beneficial. But what I'd like to say about all of this natural approach, there's really not many, guys. But when it comes to this, I don't want you to feel like guilt that you've done all of these things for weeks, whatever your natural modalities are that you've tried to make sure that you're Group B strep negative. The reality is you still might be positive. So I don't want to tell you that do all of these things and you'll absolutely be negative and you have nothing to worry about, because you could actually still be positive. So, guys, even if you test positive during pregnancy and you have to get antibiotics in labor and you've tried all the natural things and it's just kind of not working, I want you all to know that this is okay. It's just another part of like entry into motherhood. But I want you to know that sometimes these natural, whatever it is that you choose, there's not much that's well studied. So I'm going to tell you straight away, you can try all of these natural options. It's transient. Sometimes GBS is there, sometimes it's not. Sometimes the Group B strep will be taken care of with the probiotics that you use, or if you use suppositories and zinc, etc. But I hope for you, my hope for you is that you don't have this mom guilt because you ended up having antibiotics in labor.
Definitely.
Yeah. And so I was talking to you earlier. What is your take on what OBs are doing if someone refuses antibiotics during labor? Because what I'm hearing from mamas, and guys, I'm not an OB, but what I hear from mamas and some of my pregnant mamas here in Arizona, I have to say a caveat. Here in Arizona, we have amazing midwives.
Oh, that's awesome.
Oh my gosh. And we have a couple amazing hospitals and a couple amazing OBs. And so I know where to refer my pregnant mamas to get like really good care where they can have true informed consent. But I have heard from mamas who are like, I'm going to get dropped by my OB if I choose not to have antibiotics in labor. So what have you heard, or what are your thoughts?
I mean, really, the fact that I was not informed that I was Group B strep positive in my urine, and then until 36 weeks, and she was so just like, oh, you will get this in labor. I mean, it felt like very condescending to my personal choice in the matter. I was like, do
Yeah.
I even get a choice, And so the fact that she even let me test again, I was surprised. But, I do think doctors are, there's a lot of liability when it comes for OBs have the highest malpractice in
Mhm.
terms of
Doctors.
litigations. And yeah. So to add one more thing onto that, that's why they don't want to deal with it. But I think that is making it so they don't give true informed consent on the matter.
And I'll also say I'm not an obstetrician, but I will say that we have governing bodies and you have to abide by the governing body's policies. And the governing body's policies for ACOG is you must deliver antibiotics at birth or you're going against their recommendation. And so I understand why there are OB-GYNs who are just like, sorry, no, like this is standard
Yeah,
protocol. This is standard of care. That has been handed down by my governing body, and this is what I have to do. And so I'll say a couple things. If you're positive, and I've said this earlier in the podcast, if you're positive early on in your OB, ask your OB early on. Hey, look, I want to retest at 37 weeks. I want to retest urine and I want to retest the anovaginal swab. If I test negative for both of those, I want to decline antibiotics during labor. What are your thoughts? And early on, if they come back and say, sorry, you have to have antibiotics during labor, you have plenty of time to be able to find another OB-GYN who aligns with your beliefs or a midwife. And so I just want you to keep that in mind. And I do have a national OB-GYN list, a provider list for those obstetricians, gynecologists, and midwives who align with informed consent. And so if you can't find one in your area, please check on my website for the free guide. It's a free list of medical providers who are OB-GYNs and midwives, because you might be able to find one in your area. But you have to do this early on. If you wait until 37 or 38 weeks, you're going to be so hard pressed to find another provider who's going to take you on prior to birth. So get your ducks in a row and early on ask these tough questions like, hey, this is what I want to do. Do you align with my beliefs?
And that goes for pretty much anything
Yeah.
kind of in pregnancy too. Like if they aren't gonna, let you push the way that you want to, or if you're really interested in a water birth and they don't
Mhm.
allow for that, then you got to have those conversations early on so that you can switch your providers if you would like to.
Absolutely. So I'll ask you this, and I don't know this. Is there any emerging research coming out for GBS treatment besides antibiotics? I haven't been paying attention.
Yeah, well, of course, they would love to come out with a vaccine for GBS.
No kidding. This is new to me.
That is, I guess, in the works. All I've heard is that they would like for it to happen. I don't know kind of what stages it's in. So, like all vaccines, we need to have informed consent about that product as well. And it's just kind of
Yeah.
another vaccine in pregnancy, which what's better? Is it better to do the antibiotics in labor and go with that intervention? Is it better to do a vaccine during pregnancy?
Yeah, those are questions to have.
I'd be curious to see what they would recommend. I have my, own thoughts about vaccines in pregnancy. I know you do too. And it's just, it feels like they're trying to give a vaccine for everything.
Well, I think we can almost end on that because I agree with you. on, so I'll just end with this that currently I do still recommend to patients that if they are Group B Strep positive in their 37th week of pregnancy, with urine and or the vaginal swab, I do recommend antibiotics at birth. And unless you are informed about the other risk factors, which Katie was able to give us some of them, and I'll put in the show notes, just keep in mind that the more fully informed you are during your pregnancy, the better the outcomes will be, no matter what, because you'll be able to make those like split second decisions, or you'll be able to say, hey, look, you know what, I did decline antibiotics in labor, but my labor's not progressing the way I wanted and my water broke. And so maybe it's time to do antibiotics. So I hope that this podcast has been helpful to give you a little bit more information about Group B Strep and what it is. I, was clueless when I was a new doctor coming out with my firstborn. And, thank goodness I was Group B Strep negative, but I didn't even know. So I hope, and I like it.
Isn't that funny?
Yes, the tide is changing. Well, girl, there's like a lot of things I didn't know after my firstborn with regards to medical care, because at the time I wasn't treating kids, I wasn't treating infants, and I wasn't treating pregnant women, and so we learn as we go. And I'm so happy to have you on board. And Katie, I really would love to have you on again. I'm nervous that you and I would go down like rabbit hole after rabbit hole regarding vaccines.
We would.
Maybe we can pick like a topic that we can, maybe we can do that next.
Yeah, that would be really fun.
I want to thank you so much for being on. I think we've talked about enough about GBS. Do you have anything else that you want to say before, like final anything?
I really, maybe, just a quick tidbit here about the testing. With Group B
Oh,
Strep
yes.
testing in general, the swab, there is a rate of false positives and false negatives. And so it's about 15% on either side, which is not a small amount. I mean, really. So even if you test negative, it's a transient bacteria. You could later be positive. There's about a 15% chance that test was negative and you're actually positive, and vice versa. If you're positive, there's a 15% chance that you could actually be negative when you give birth. Ultimately, with those statistics, we're talking about so many women who are positive getting antibiotics in labor, when really, because of the actual incidence of Group B strep disease, and we treat it prophylactically in America, 98% of women who receive antibiotics in labor are receiving it unnecessarily because their baby wouldn't have even gone on to be sick. So it really is interesting to think about how the test is done, think about the false positives and the false negatives, be informed of the risk of the disease, the cons that come with antibiotics, but also the pros. With Group B strep disease, the consequences are really serious and can be debilitating even if the child does survive. So it's something where you get the test. If you test positive or negative, no, there could be a little bit of wiggle room there. And also just be informed of your risks and benefits for both decisions when it comes, because it is a hard one. It's definitely a hard one that I don't think women should take lightly.
I appreciate that. And at the end of the day, I'm not sure that your doctor is going to let you, however, test again, because I would. If you came in to me and you were like, hey, doctor, I just ran a test, or I just got my results back. Do you think you could run them again? Because I want to know if this is accurate. I'd run them all day for you. I don't care. And just so you know that your insurance might not cover it, and you're going to have to pay out of pocket. But most doctors won't let you do that. So if you have a Group B strep positive test and you want to run it again yourself, go to LabCorp Norquest and see if you can get it run, or you can go to a Minute Clinic, I'm sure, and see if you want to get it run to see if you can get a different outcome. The urine test is quite accurate.
Oh yeah, definitely.
There's not much of a 10 or 15% wiggle room. If you test your urine for Group B strep and it comes back positive, you're damn straight that it's positive. We're talking about the vaginal anal swab, that there is some wiggle room with false positives and false negatives. But at the end of the day, again, if you test positive for Group B strep in your 37th week, be understanding that there are some other potential risk factors for wiggle room. And then take a look in our show notes and see exactly what those are, because I do want you to be able to make that decision throughout your labor if things do change.
Yeah, absolutely.
Most of my listeners are going to want to say no to antibiotics at birth if they're Group B strep positive.
Yeah.
But I also want you to know that if things aren't progressing the way that they should be, I want you to also know enough to say, yes, I actually want you to do these antibiotics. Okay?
Absolutely. Absolutely. And it really is so important to know that even if you do make that decision, you haven't lost a battle. Like if you are in labor and you choose to get antibiotics in labor, you are doing what's best for you and your child. And that's something where you should feel no shame in that. You just know, like, okay, now my child and I have been exposed to antibiotics, so let's do the things to help us after that.
Let's do all the things we got to do to make us healthy again.
No big deal.
And I love that. Katie, it's been so wonderful speaking with you. And I hope all of you have gained a little bit more of informed consent today. And I have no idea what our next podcast topic is. I actually think it's homeopathics for immune support.
Ooh.
I have a lovely woman who owns a lovely homeopathic company in Australia. And I think that's what's coming up next. And so I want you all to have a wonderful day. Thank you, Katie. And have a wonderful day.
Thank you so much. Bye, everyone.
Bye, everybody. I have so much more to talk about. So if you'd like to continue listening to this conversation, please join my VIP membership community. After signing up, you'll have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. Join my community at drgreenmomvip.com. Thank you for listening, and I'll see you next time.